Good morning. So this is a question from Sophie about her 13-month-old, and basically you're asking about the night wakes. So looking at your message, it looks as though um, she doesn't quite have enough sleep during the day. Um, so we're looking at about, I did make some notes, about 2 to 3 hours of daytime sleep, I reckon. But don't forget that these are just a guideline. So if this doesn't fit, because you said, you looked at the routine in the vault for Sydney's age, just because she fits in with all of those things doesn't mean that that suits her. They are just a guideline. There's no evidence that says this is what a child of 13 months old should be doing. What I would do is go back to watching her tired cues, her sleep cues, and respond when she starts showing that she's tired. 6:30 is quite an early bedtime, and the fact I know she was awake for an hour, but the fact that she's having 12 hours, I mean, she was in bed for 13 hours, but she's having 12 hours of sleep overnight, even though she's got that awake time. That is actually pretty much all the sleep she needs. So for that age, you're looking at between 11 to 14 hours of total sleep in the 24. So she's kind of getting that. What I would suggest doing is increasing the amount of nap time and putting bedtime later. Um, Try that. Anytime you're going to try anything, you've got to do it for about 10 days. Now, don't forget, if she is needing a cuddle and needing to be fast asleep before she settles in a bed, then trying to move away from that is going to be really helpful, because basically we want her to be able to turn over and go back off to sleep in the middle of the night and not need that kind of support. So it's about working how to gently transition away from that. Is that something that she does at night time when you put her to bed, or is it just in the middle of the night? It's a lot easier to do it, to change things, if they do it at bedtime, because of course in the middle of the night you can't be asked with all the changes. You just want to do what you need to do and get them back to sleep, which is fair enough. But what I would do for the time being is try the slightly longer naps during the day, push bedtime back till about 7:30. Try that.